Everybody. Thank you all so much for coming tonight. My name is Jennifer Hearn. I am the Chief Officer and Permanent Secretary in the Ministry of Health and Culture, and I'm so excited to be here tonight. And now they're sounding the chimes. Okay. Honorable Alden McLaughlin, MBE, JP, MLA, Premier of the Cayman Islands and the Minister for Home Affairs, Health and Culture. His Excellency, the Acting Governor and Deputy Governor, Mr. Franz Manderson. Councillor Roy McTaggart, Councillor in the Ministry of Health. Mr. Jonathan Tibbett, Chairman of the Health Services Authority Board. We also have the CEO of the Health Services Authority, Ms. Lizette Yearwood. I also want to have a huge welcome to our Premium Plus sponsor, Tenet Healthcare International, our cocktail reception sponsor, who you'll all have to thank later, Iron Shore Pharmaceuticals, and our premium sponsors, the Cayman Islands Health Services Authority, DART, BAF Insurance, and Tower. A huge welcome to one and all, distinguished guests, sponsors, speakers, and delegates. Tonight, we open the 6th Annual National Healthcare Conference. Ladies and gentlemen, we have seen this conference grow year after year, and I am so excited to tell you that over the next 3 days, we are expecting over 800 people to come through those doors and to hear some of our fantastic speakers that we have ahead of us. You may have heard us on the radio telling everybody that we had closed registration. So the fact that you are sitting here means that you were one of the lucky ones who managed to get through before we filled up. So I'm so excited to be here. We've got 40 exhibitors, 50 sponsors, and without those exhibitors and sponsors, we would not have been able to offer the conference free of charge yet again. So can I ask you all to give a big round of applause to our sponsors? One of our national pastimes is finding free Wi-Fi, and I'm pleased to report that we do have Wi-Fi for the conference. If you go to your Wi-Fi, you'll see it's Ritz-Carlton Conference, or Ritz-Carlton Conf, and the password is Generali, all lowercase, G-E-N-E-R-A-L-I, okay? So thank you to Generali for sponsoring the Wi-Fi and making it free for our conference. As I mentioned earlier, I just want to ask you again, please make sure that your cell phones are either turned off or on silent so that it doesn't interrupt any of the proceedings tonight. You may have noticed as you were out in the hallway and hopefully in the room next door, we have a lot of exhibitors this year, more than any other year, and there's a lot to see and do with our exhibitors. Please make sure you do go around, visit all of them. Again, as I mentioned earlier, we couldn't put the conference on without their support. There's a health check station down at the end of the hall, so you can go and check in on your numbers, and that's sponsored by Broward Health. There's also the Cayman Islands Health Services Authority booth in the room next door, and there's 2 important things you can do there. One is you can get your free flu shot, and the other is you can sign up for the My HSA patient portal. And if you're running low on battery power in your phone, you can go to Tower's booth to recharge it, and they're just outside the door, and that'll be available over the next few days in the conference. And so with no further ado, we're going to get the conference officially started. Our first speaker tonight is His Excellency, the Acting Governor, Mr. Franz Manderson. In 2012, the United Kingdom Secretary of State, in consultation with His Excellency the Governor, approved the appointment of Mr. Manderson as Deputy Governor and Head of the Civil Service. He is responsible for the management and performance of the Civil Service. He's my boss, and the Civil Service has a budget of over $500 million and 3,600 staff. He is a member of Cabinet and is the first official member of the Legislative Assembly. Mr. Manderson joined the Cayman Islands Civil Service in 1981 as an hourly paid worker with the Immigration Department. He was promoted up the ranks of the department and was appointed Chief Immigration Officer in July 2004. During his tenure with the Immigration Department, he received many awards, including the Certificate and Badge of Honor for services rendered in the management of the Cuban migrants in the Cayman Islands, the Governor's FACE or FACE Award for Excellence in Customer Service, and Person of the Year in 2006 by Cayman Net News. In July 2009, he was promoted to the post of Deputy Chief Secretary in the portfolio of Internal and External Affairs. Following the coming into effect of our new Constitution, which renamed the post of Chief Secretary to Deputy Governor, Mr. Manderson's title changed to that of Chief Officer, and as chief officer in the portfolio, he was responsible for an annual budget of approximately $70 million and over 800 staff. Mr. Manderson is also an attorney at law, having completed his legal studies at the University of Liverpool. He was called to the Cayman Islands Bar in July 2004 and was appointed a Justice of the Peace in 2008. Mr. Manderson is married to Nuvia and has 2 children who he's very proud of, Alyssa and Franz Jr. Ladies and gentlemen, please join me in welcoming the acting governor, Mr. Franz Manderson.
Good evening, everyone. It's a great pleasure for me to be here. I know protocol has been established, but allow me to recognize our premier and Ms. Ahern. As you can see, I'm a lucky guy to have a chief officer like Ms. Ahern to work with. This conference is just a testament of her leadership and ability, so congrats, Ms. Ahern. I also want to recognize our acting cabinet secretary over there, and we have 2 of our outstanding chief financial officers, Ms. Pucci and Mr. Cooper. Congratulations on the great work that they're doing. You must understand that as head of the civil service, I cannot pass up a chance to highlight some of the great people that we have there working with us. But tonight, I'm acting governor, so I'm going to focus on the task at hand. And on behalf of our Excellency, I want to welcome all of you to this conference. And I want you to have a really engaging time and enjoy the many sessions that we have. Her Excellency would love to be here. She's on a staycation. She's enjoying what Cayman has to offer. So we wish her a good time at home. I think many of us, our sponsors who we thank so much for making this a free event, the organizers and the practitioners, we wonder sometimes whether these conferences make a difference, and are we reaching our audience, and are we really promoting health care and a healthy lifestyle? And I have to tell you that you are. In 2013, the conference theme was healthy workplace. And Ms. Ahern, after the conference, came to me and she says, Deputy Governor, you know, we really need to promote health in the civil service. And I'm very pleased to say that what we learned here, we now have transformed the civil service in what we are doing in terms of promoting health and wellness. We have a run-walk club that I take part in along with Ms. Ahern. I can't keep up with her, unfortunately. I'm getting there. But it has really done a lot for our civil service. Health of mind, health of body. We are doing so much, and our civil servants are being so active that it is such a great pleasure for me to see that. Not only do we have our own run-walk club, but we take part in other events. And we actually not only win those events, but then we get the awards for having the most participants. All that really makes me proud, but it all started here. It gets better. Ms. Ahern said, well, Mr. Manderson, you should have your own Deputy Governor's 5K. So we now have the Deputy Governor's 5K challenge. Too bad it's not happening tomorrow or next week. You could have all been there. But that event, again, promoting health, promoting wellness, has raised over $60,000. It's been attended by over 2,000 persons, and we've given money back to our charities. But again, it's all about health and wellness. So I want to thank all of you for being part of this initiative. You've made a difference, certainly in my life, and the lives of many of our civil servants, and generally in the Cayman Islands. So I can't thank you enough for what you do as practitioners, the sponsors who are making this event happen. We're very grateful. Now, I know that the theme for this year is about emerging trends, and you're talking about stem cells and robotics. I'm not sure what idea Ms. Ahern's going to have about those areas, but I look forward to that. But really, I want to welcome all of you, encourage you to take part in the conference and attend the sessions, and have a really enjoyable time here. Thank you.
Thank you very much, Your Excellency. Our next speaker tonight is the Honorable Alda McLaughlin, MBE, JP, MLA, Premier of the Cayman Islands, and Minister of Home Affairs, Health, and Culture. He's my other boss. Premier McLaughlin was first elected to the Legislative Assembly in 2000 and has been a legislator ever since. He served as the Minister of Education, Training, Employment, Youth, Sports, and Culture from 2005 to 2009. Under his leadership, the ministry was responsible for the creation of the new Education Modernization Law and piloted its passage through the Legislative Assembly in early 2009. This new law raised the mandatory age for school attendance from 16 to 17 and set in place the framework for what is now being called the Year 12 program in the government high school system. For his contribution to constitutional development in the Cayman Islands, Her Majesty Queen Elizabeth II awarded him the MBE in the Queen's Birthday Honors in 2010. In February 2011, he became political leader of the Progressives, of which he is a founding member. He was subsequently sworn in as the leader of the opposition in the Legislative Assembly of the Cayman Islands. He was named Premier following the general elections in May 2013, where the Progressives won the majority of seats. The Premier is also a lawyer of 25 years standing and a former partner in the Cayman Islands law firm of Charles, Adam, Ritchie, and Duckworth. He's a past president of the Caymanian Bar Association and the Lions Club of Grand Cayman. He and his wife, Kim, have two sons, Dagan and Kaylin. Ladies and gentlemen, please join me in welcoming the Premier.
Thank you, Ms. Ahern. Good evening, everyone. It is my distinct pleasure to welcome you to the 6th Annual Cayman Islands Healthcare Conference, which seems to be growing in popularity every year, given the numbers that are in attendance. The last time I addressed this conference, it was purely in my capacity as Premier, but it proved such an exciting event. And it seems like so many wonderful people are here that I went back to the government administration building and I took over responsibility for health to make sure I could get to come back. I want to especially thank our sponsors for their continued commitment to ensuring that this important event occurs in our community. I also thank our accomplished local and international healthcare providers for giving up their time this week. To all of you who are here, I thank you for taking the time and effort to join us as we dedicate the next few days to this year's topic, Embracing Emerging Trends. It is an exciting topic, providing an opportunity to discuss issues such as planning healthy communities, palliative care, mental health, emerging trends in cancer care and treatment, cardiovascular health, and allied health. These are all topics that I dare say are germane in one way or another to everyone in this room. We are all at some point users of medical facilities, and some of us have had or are currently involved with palliative care to help improve the quality of life for patients and their families. Mental health is such an important issue in our community that my government has recently signed on with KPMG for that company to produce an outline business case for a proposed long-term residential mental health facility. We are keenly aware of the challenges faced by those who are mentally ill, their caregivers, and health care practitioners in the absence of such a facility. I think I can safely say that everyone in this room has been affected at one time or another by cancer. If you haven't had it yourself, you certainly know some friend or family who had or has it. And cardiovascular disease is certainly nothing new in this small community. According to the World Health Organization, cardiovascular diseases are the #1 cause of death globally. More people die from cardiovascular diseases than from any other cause. An estimated 17.5 million people died from these diseases in 2012, representing 31% of all global deaths. Of these deaths, an estimated 7.4 million were due to coronary heart disease, and 6.7 million were due to stroke. In fact, today is World Stroke Day, and Cayman's own group of stroke warriors is gathered as I speak at Public Beach for a stroke walk, talk, and swim. Stroke Warriors was founded by a young married couple after the husband had a stroke more than a year ago when he was just 32. They knew there were others in our community who had also suffered strokes and who probably had the same experiences and questions they did and do as they continue to make the journey through to recovery. They formed Stroke Warriors under the umbrella of the Cayman Heart Fund in an effort to bring stroke awareness and become better advocates of those who have suffered strokes. Many of our people in the Cayman Islands suffer from hypertension, and diseases of the circulatory system are one of the most common causes of death in Cayman. That is just one portion of the next 3 days of this conference, which will be as informative and educational as possible for the general public and the medical community. Over the next 3 days, you will hear presentations from some of the most esteemed healthcare professionals in the world. To kick things off tonight, you will hear from our opening night speaker, James Moore of the Urban Land Institute, the world's premier real estate development organization. He will share with us his thoughts on designing communities for health and wellness. Most recently, Institute members and staff have been studying ways in which the planning, design, and development of communities directly and indirectly impact the health of the people who live and work in them. This research builds on emerging concerns linking increases in obesity, diabetes, and other chronic health conditions to environmental issues, including lack of exercise and diet. Tomorrow, you will receive an overview of the reasons for palliative care and how your own stem cells can help you heal. Minimally invasive robotic surgery will be one of Friday's topics, with a discussion on current trends in surgical oncology and management of gastrointestinal malignancies. Vascular surgery and heart health discussion are also on tap, and our own Dr. Mark Lockhart will be bringing us Bridging the Gap, the State of Mental Health, Cayman Islands 2015. Also on Friday are 3 intriguing interactive workshops, which include matters to consider when making end-of-life decisions, talking openly and honestly about mental health, and a look at non-medical therapies. These workshops are important because they offer a platform where delegates and stakeholders can talk with one another, hear ideas from both local and overseas representatives, and help broaden the knowledge base of our own citizens who are looking for answers for their own particular medical needs in this range of topics. On Saturday, discussions delve even further into palliative care, and there's a topic concerning how psychology is used when treating patients. Wrapping up the sessions on Saturday will be an all-encompassing topic concerning the 10 big ideas for the next 10 years in healthcare. We are indeed blessed and fortunate to have such an impressive lineup of speakers and relevant topics and workshops for this year's conference. And I believe that this year's timely topic, Embracing Emerging Trends, is a natural follow-on from last year's conference, which focused on winning the war against chronic, non-communicable diseases. Each year, we use these healthcare conferences to make real and tangible differences in the health and wellness of the people of these islands. While the conference is a forum for education and information sharing, we have always made it our number one goal to include workshops and breakout sessions that result in recommendations to the Ministry of Health and Government, so we can include feedback from the community when we are doing our short and long-term planning. For instance, last year, the director of the Caribbean Public Health Agency, Dr. James Hospitalis, spoke at the conference, reminding us that it will take multi-sectoral collaboration to achieve our national vision of health and well-being for all in the Cayman Islands by asking, where are the architects, developers, and land use planners of last year's audience? The connection between land use planning and health is an emerging trend in the planning and development of community worldwide. To that end, we invited James Moore as tonight's opening speaker. This is particularly timely given the work that my government is embarking on with regard to what we are calling the revitalization of Georgetown. Similarly, at last year's conference, we heard from the delegates that two areas they would like to explore further were mental health and end-of-life or palliative care. So the Planning Committee made sure to include these in this year's conference. We are also working with the Pan American Health Organization to identify ways to strengthen our monitoring capacity for chronic non-communicable diseases, particularly in the area of hypertension and diabetes. This government is committed to helping the public improve its health. Personally, healthcare is a matter close to my heart. Pardon the pun. To borrow a colloquialism from the most southern parts of the United States, I got it honest. My father, McNee, worked in the Department of Environmental Health before there was such a thing, and helped what is now called the Mosquito Research and Control Unit, or MRCU, and was one of Cayman's first qualified public health inspectors. My mother, Althea, did 36 years in the same job, or I should say in the same place at the Cayman Islands government, starting as a dispenser in 1951. And as I suppose most of you might know, the acting chief medical officer over there happens to be one of my sisters. So you see, I can't help but keep up my family's mandate and commitment to helping the public improve its health. Still speaking personally, I have taken my own health very seriously, particularly as these years roll on, and I make it a point to commit weekly to an exercise regime that includes time in the gym and on my bike. As the Deputy Governor, the Acting Governor has said, there are a significant number now of my colleagues in the public service who have also become increasingly health conscious with the Monday afternoon walking club and the DG's 5K run, which the Acting Governor also referred to, now in its second year. And as he said, that is also an offshoot of one of these healthcare conferences. My great challenge now is to get a couple of my ministers to join. I haven't given up. Yes. I keep telling them, if you are sick or dead, you're no good to me. In embracing emerging trends in medicine, the Cayman Islands Health Services Authority this year has installed a sophisticated laser that is the newest and most effective piece of equipment available for treating kidney stones. The Health Services Authority has also been hard at work in ensuring that all members of the public get free and easy access to information regarding their own blood pressure levels by opening blood pressure kiosks at the Government Administration Building, the Cayman Islands Hospital, and the Faith Hospital in Cayman Brac. And in December last year, the first endovascular repair surgery was done in the Cayman Islands. Previously, a patient would have had to have been flown off island to a large hospital within the US to have this specific surgery. While I'm bragging about the Health Services Authority, I have to mention that in March this year, the Joint Commission International, the leading international healthcare accrediting body, accredited our pathology laboratory. We also celebrated the accreditation of the Cayman Islands Forensic Laboratory by Forensic Quality Services, a signatory of the International Laboratory Accreditation Cooperation multilateral recognition arrangements. The accreditation means the Cayman Islands Hospitals Forensic Laboratory is the only accredited laboratory in the Caribbean British Overseas Territories. The Health Services Authority's focus continues to be on providing services that inspire confidence, deliver professionalism of the highest quality, and ensure reliability for both healthcare professionals and patients. Delivering a first-class healthcare experience is what we strive to achieve while instilling international standards, pride, and confidence in the Cayman Islands. Before I leave the subject of our Health Services Authority, I must thank again Dr. Kiran Kumar, who retired from his post as Medical Officer of Health and Director of Primary Health Care earlier this year. His retirement marked an incredible 33 years at his post. He was a pillar of the Health Services Authority community and the driver of so many important health initiatives. He was at the forefront of the Cayman community's health, and for that, we are deeply grateful. It is through his vision and leadership that the Health Services Authority continues to excel and grow. One of the ways we are working with our patients is through the MyHSA patient portal. This is a free online service where patients can request, reschedule, or cancel appointments. They can also review test results, send secure messages to Health Services Authority staff, view immunization, allergy, and health history information. MyHSA is part of this government's commitment to the development of e-government to make it easier to work with government and the civil service. The software provided by Cerner gives patients online access to their medical records 24 hours a day, 7 days a week. The online service also allows patients to receive reminders of important care items or appointments. The service is also mobile-friendly, offering optimal viewing on a smartphone or tablet. We all live much of our lives these days electronically when it comes to accessing information, doing banking, shopping online, and so on. So we believed that the delivery of health information should be no different. Before I close, I want to focus our attention on our Premier Plus sponsor, Tenet, one of the largest investor-owned healthcare delivery systems in the United States. Tenet continues to show its support as the top-tier sponsor of this conference, a commitment it has demonstrated annually since the inception of this annual event. It is because of the support from sponsors, especially Tenet Healthcare, that we are able to continue to host this world-class conference. I also thank our premier sponsors, Ironshore, the Cayman Islands Health Services Authority, BAF Insurance, DART, Tower, and Chrissy Tomlinson Memorial Hospital. Having such a strong sponsorship contingent means we can once again offer attendance to the conference free of charge for the general public. And that results each year in our ability to fulfill our main mission, which is to reach out to as many of the residents of our islands as possible to help offer them solutions to improve their health and well-being. To each of the sponsors, on behalf of the conference organizers and the Ministry of Health, we offer our sincere gratitude. It is because you recognize the importance of events such as this one and your participation that ensures this conference's success year after year. I also thank the public sector, the private sector, and the charitable organizations that have worked together to make this a truly collaborative affair. It is evidence that we all agree that we have to take a collective responsibility in dealing with health matters and ensuring that we know what the emerging trends are and embrace them. I look forward to the next few days and the ideas and solutions that emerge to explore and embrace emerging trends to help us create a healthier country and world. I am sure the sessions and discussions will be thought-provoking and productive. To those of you who are visiting, again, I welcome you to the Cayman Islands. While you do have an intense agenda, I hope that you find time to enjoy all that we have to offer, from our sugar white beaches to the true gem of our islands, our beautiful people. Thank you for your attention. If you see me slip out, it is because I have to deliver a graduation address at UCCI at 7. It is not because I don't want to hear my sister's closing remarks. Thank you.
Thank you very much, Honorable Premier. Our next speaker tonight is Dr. Virginia Hobday, and she's here in her capacity of President of the Cayman Islands Medical and Dental Society and the Medical Director of Cayman Hospice Care. I wanted to specify that because as I read her bio, you'll come to understand that Ginny wears a lot of hats. So I just wanted to clarify which hat she's wearing tonight. So Ginny, welcome back, by the way. Ginny's just been in the UK to receive her MBE. Big round of applause for Ginny. So Dr. Hobday is a family physician at Cayman Clinic and the medical director of Cayman Hospice Care. She trained at St. Bartholomew's Hospital, London, and completed her specialty training in general practice at London Teaching Hospitals and was admitted to the Royal College of GPs. She completed a master's in history of medicine and philosophy of science at Cambridge University. Dr. Hobday has worked overseas in France, South Africa, and Iraq. She moved to Cayman in 1998, and she worked in the Public Health Department of the Health Services Authority for 3 years before moving into private practice in 2001 after the birth of her first child. She has worked at the Cayman Clinic ever since and is interested in women's health and preventative health care, as well as being an authorized aviation medical examiner. She undertook postgrad training in palliative care at Teesside University after she became the medical director of Cayman Hospice Care, with which she has been involved since 2001. She's an advocate for palliative and hospice care and has hosted 4 hospice conferences in the last 8 years here in Cayman. She's also the medical director of the Breast Cancer Foundation. Dr. Hobday has been an associate professor at St. Matthew's Medical School since 2005. She teaches elective students from overseas and has been involved in the Chamber of Commerce mentoring program for high school children who are interested in medicine. Dr. Hobday is a member of the British Medical Association, a member of the Cayman Islands Health Services Authority Ethics Committee, and is currently the president of the Cayman Islands Medical and Dental Society and vice president of the Medical and Dental Council. She was awarded an Emerging Pioneer in Healthcare Award in the Cayman, our National Heroes Day in January of this year. And as I mentioned earlier, she has just received her MBE, which is a member of the British Empire, in the Queen's New Year's Honours List this year for her services to hospice in the Cayman Islands. And she collected that from Her Majesty the Queen in London earlier this week. Ladies and gentlemen, please join me in welcoming Dr. Hobday.
Good evening, ladies and gentlemen. It is really a pleasure to be here with all of you tonight. I look forward to this health conference every year. I would like to thank the Ministry of Health and Jennifer Ahern, as well as the organizing committee and their chair, Lizette Yearwood, for inviting the Cayman Islands Medical and Dental Society to be part of this welcoming address for this 6th healthcare conference. Like many of you here, I have attended the last 5 of them. They have been a very valuable opportunity to step out of our everyday work environments and get a different perspective on healthcare issues. As my grandfather, who was a forester in the Highlands of Scotland, used to say, you can cut and plant trees all year long, but you have to go up to the top of the mountain to look down on the forest to see how you are doing and where you need to go. Perhaps that's where the words, you can't always see the woods for the trees came from. This conference is also an opportunity to learn a great deal from the distinguished visiting speakers and from our own healthcare colleagues and members of our own community. You may be wondering what the Cayman Islands Medical Dental Society is. It has been in existence for over 30 years and provides a forum for doctors and dentists to consider issues which affect our professions and the health of our patients, the healthcare community, and to debate issues and reach a consensus so that we can speak with one voice to agencies and government in order to effect change. Despite strong and varying opinions, as you can imagine, amongst doctors, it is a vehicle for change, and that is what this annual conference has come to be for me. As the Premier mentioned a few moments ago, Dr. Kumar retired this year, and he was awarded unanimously the CIMDS Award for his long service to this community. This year, I am really encouraged that the feedback from previous conferences has resulted in the topics we are considering under the overview of embracing emerging trends. And when the committee tell you they're going to take the information back and use it and effect change, they really do. With my hospice hat on, I am very pleased that palliative care is high on the agenda and that we have two eminent speakers, both of whom we have previously had the pleasure of meeting and benefiting from their expertise. The experience from other jurisdictions and specialists in their field help us to avoid the unnecessary work of reinventing the wheel. In palliative care, collaboration and the sharing of information is the foundation of the work culture in this field of medicine. Whenever you visit hospices around the world, as I have done to many, they are always willing to give you as much information as they can to help you. And we pass back and forth in order to improve the lives of our patients. It is a truly necessary specialty and has proven how cost-effective it is in a climate of spiraling health costs. So I welcome Dr. Thomas Smith from Johns Hopkins back to Cayman. He came and spoke at our hospice conference last year and inspired us. And Dr. Jim Cleary, who's from Australia but via Wisconsin, for his first trip to Cayman. We met him in Jamaica at a Caribbean palliative care conference, and he is no stranger to the work we have done in hospice here in Cayman and in the Caribbean region in general. I would like to bring to your attention the work of the HSA Ethics Committee. This group meets monthly and is always open to new concerns that people may have. We are organizing a conference on Wednesday, the February 17th, 2016, and the issue of mental health in adolescence and the ethical issues pertinent to this topic, in particular as regards consent, will be discussed. And that brings me to the mental health component of this conference. This was a subject that many felt last year needed more focus and recognition, particularly from insurance companies, if you will remember. And so I'm very pleased to see it taking a major part in the topics this year. It is such an important and yet underserved field, which is still bedeviled by stigma and fear. I hope further explanation and understanding will lead to improvement in treatments as the prevalence of mental health challenges in the Cayman Islands are as high as they are in the rest of the world. This month, a mental health steering committee met and is now consulting to try and improve long-term mental inpatient services, which are currently very much lacking. From a general practice point of view, we see much mental and emotional well-being issues related to work stress. Over the last 10 to 20 years, many countries have changed their workplace culture. In medicine in Australia now, it is now viewed that working overtime and not taking sufficient leisure time is actually considered counterproductive to the worker and indeed compromises patient safety. Note to self, workaholics are not to be encouraged. The root cause of many of our current health problems, which are linked to mental health problems, are due to the inadequate work-life balance that most of us have or don't achieve. The new trends in vascular surgery, oncology, and regenerative medicine are fascinating, and I look forward to hearing from these presenters, who I'm sure will bring us up to date with their latest developments. I congratulate the organizers for recognizing that openness to change and to lifelong learning is vital in the constantly evolving field of healthcare. And I would also like to thank all the sponsors who have made this conference possible and free to all who register. In particular, Tennant, who is the major sponsor. I have personal knowledge of their Good Samaritan Hospital in West Palm Beach, where my sons were born, and where my brother was treated for stomach cancer, and I can certainly vouch for their professionalism. Thank you all for taking the time to attend. I look forward to the opportunity we have to engage in a fulfilling learning experience and to thereby hopefully improve the health of the residents of the Cayman Islands. Thank you.